Hello, my name is Sade and I will be doing an informative speech. Trying to manage diabetes is hard because if you don't, there will be consequences that you'll have to handle later on in life. The reason why I'm so interested in this topic is because my uncles and aunties have adult diabetes. So I wanted to learn more about it. So what I did was I researched more on adult diabetes. So today I'll be telling you what is adult diabetes, what causes adult diabetes, and the symptoms of adult diabetes. What is adult diabetes? Adult diabetes is a disease that causes your sugar level to be out of whack, which means a person's sugar level can read too high or too low. Type 2 diabetes, once known as adult onset or insulin dependent diabetes, is a chronic disease. The way your body muscles sugar your body main source of fuel. Next, I'll be telling you what is the causes. When having type 2 diabetes, your body doesn't respond correctly to insulin, which means your body, when sugar cannot enter, a high level of sugar builds up into the blood. This is called hyperglycemia. Family history and genes is a play role of type 2 diabetes. Insulin is a hormone produced in the pancreas by a special cell. This special cell is called beta cell. The pancreas is behind the stomach. Insulin is needed to move blood sugar into the cell. That this is stored later for use of energy. When having type 2 diabetes, your fat, liver, and muscle cells do not respond correctly to insulin. Next, I'll be telling you the symptoms. Bladder, kidney, skin disease, and other infections. Your first symptom you will have is blurry vision and pain, numbness in feet or hands, and sweating, and have to use the restroom more. Being overweight can cause you to be a diabetic. Increased fat makes it harder for your body to use insulin the correct way. If you are having feet or legs, problems with your eyesight, feeling weak, and need to use the restroom more, you should contact your doctor. Next, I have a video.
Diabetes. Although it can occur at any age, it is more common in people who are overweight, sedentary, and glucose is the main source of energy for body cells. When blood sugar levels rise, as is normal after a meal, the pancreas gland, located behind the stomach, secretes the hormone insulin. Insulin enters and circulates in the blood and acts on the insulin receptors present in muscle, fat cells, and other tissues of the body. Binding of insulin to these receptors causes the glucose transporters to come to the cell surface. This facilitates the entry of glucose into these cells. In diabetes type 2, the production of insulin is low, and sometimes there may be resistance to insulin. The circulating insulin fails to facilitate the absorption of glucose into the cells and to keep the blood glucose level at optimum levels. This results in the rise of blood glucose levels. The excess in blood glucose reacts with proteins in tissues to form what are known as advanced glycation end products, or AGEs. AGEs create an inflammatory condition in the vasculature, which causes heart disease and damage to other organs, such as the kidneys. Diabetes can eventually cause damage to the heart, arteries, kidneys, nerves, eyes, and skin.
concludes my presentation. If you want to avoid diabetes, you should keep in shape, exercise, and look at your family history. Thank you.